Hi, Dr. Simon Agger, chiropractor and clinical nutritionist. I'm here to tell you about the connection between the brain and the body. Did you know that when you have a restricted joint and it's not moving well, we get it adjusted, first thing it does, it sends a message up to the brain, giving the brain a new information that the body's moving better. And as a result, your muscles can relax, some of the stress is taken off other joints, and you have less pain. In a nutshell, we're working different communications in the nervous system through the brain every time we adjust the body. And that's why you start having less pain and your body starts to function better. Now, one of the things that we need to tie this into is how does this affect your treatment? Well, your treatment is taking a compensated body where we may have some tight muscles, and when a muscle's tight, it means it's just shortened a little bit. It's a little tighter. Why is it tight? Because it's usually protecting a joint which is inflamed. And we can see vertebrae here, they have joints on the back side and they can get jammed. They can get so they don't wiggle like that anymore. They're often sore when we palpate and examine them. They're very sore and tender. And as a result, you have faulty movement patterns where instead of all three joints down here moving in a coordinated manner, we have maybe a block all moving together and you get pain and stiffness. The reason you get pain and stiffness is because you've got some injury down there and the body is often in a splinting spasm in the muscle to try and protect your spine. So as we move from this compensated state into a less compensated state, we have less muscle tightness. We have more individual segmental range of motion. And we're able to start doing our spinal stabilization exercises to make sure that it goes from a compensated state, which is painful and not working structurally for us, into something that works a lot better and we're pain-free and we can move around, okay? So the neural repatterning that takes place is every time we adjust this, it means that we're sending a new message to the brain saying this is the direction which is normal. And as the brain gets that message over and over again through repeated visits, it starts to pay attention. The muscles start to relax and we're able to do more exercises without pain. We're able to do more activities of daily living like putting on shoes, riding in cars, sitting in cinema seats and picking up kids or gardening. We can start doing more of those things. And that changes for all of us depending on how compensated we were to start with. So for example, if you only had small compensations, we'd move through some of the phases of care a lot quicker, and we're going to talk about phases of care here. There's always three phases of care when you're receiving care. The first phase is always decreasing inflammation and pain. We're trying to put the fire out so that we can get on with our lives and not be impeded. As soon as the pain's down, I'm seeing you less frequently. And in that time, we're doing more exercises and we're starting to incorporate some of those other activities that were bugging you before that might have even injured you in the first place. As we repattern and repair, we get to a point where we're able to do things that we could do before. We're able to do all the things we wanted to do before, not getting pain, not getting flare-ups, and we're good to maintain at that area. And that puts us into phase 3, which is of maintenance and support care. Now, how long you take in each one of these phases depends on a number of factors. Your overall level of health to begin with. Are you on any medications? Do you have any cravings? Do you have any chronic inflammation in your body or in your muscles? They all affect how fast you heal. Do you get regular exercise? Do you get regular sleep? So are you relaxed or are you stressed 9 out of 10 every day that you get up and work or interact with your family? They all make a difference. Obviously, some of those bigger stresses, you're going to take longer to heal. Some of those of you that are less stressed in some of those areas are going to heal a little quicker, and everything in between. So I hope that gives you some insight into the 3 phases of care, and it also gives you some insight on why the body starts getting better with repetitive adjustments. It means that we're retraining the brain's idea of what's going on in the body. We get a new map. We have a less compensated state, so we have less pain and dysfunction, and you get to thrive. Again, my name is Dr. Simon Agger, and thanks for listening.